Hello, this is David Kettlewell, and welcome to Medical Matters. Change is in the air for America, and perhaps in no other area as much as healthcare. What are Americans concerned about? We'll see these clips in a moment. We have two of the nation's top experts on health policy to guide us through this topic. But let's hear what people on the street are saying they're concerned about relating to healthcare in America.
I think somewhere along the line we're going to have to come up with nationalized health care. The Republicans can call us socialists all they want, but what happens when their mom gets sick? Sooner or later it's going to affect everybody. Let's do something now.
I had to have an MRI done, and I got a $200-something bill from the hospital and a $200-something bill from the imaging place, and like a random other bill. So I'm paying about close to over $500.
You count on your doctors and the medical community to be knowledgeable, informative, take care of you, have your best interest at heart. And then when you go in healthy and come out in a wheelchair and unable to walk, it makes it difficult to have faith in the systems.
With the amount of money that I make, I'm way under poverty level, what I claim. So I could definitely go and get Medicare, Medicaid. I just don't want to subject myself to that system.
Biggest reason is I simply can't afford it. It's honestly, I'm an artist, and that's how I pretty much make my living. I do stuff on the side to make ends meet, but somebody that chooses that type of lifestyle, they can't afford health insurance. So it's roll with the dice, but that's that.
Is it where it needs to be today? No. But we've got the best and the brightest working on these kinds of ideas that I think that can begin the steps forward in the right direction to implement change.
This is the first in a series of shows on the future of America's healthcare system. We'll be delving into what are the problems and what might be the solutions. Welcome to the show. We have with us today two illustrious guests, and I want to welcome you both to the show. Dr. Douglas Scutchfield, you are one of the nation's leading experts on public health policy. You're author, contributor, and editor of approximately 10 textbooks. I'm sure it's hard to keep count at a certain point. Editor of the American Journal of Preventive Medicine. You're a professor in the Colleges of Medicine and Public Health at the University of Kentucky. And, last but not least, founder of Schools of Public Health at the University of Kentucky and San Diego State University. Welcome to the show.
Thank you very much, David.
Dr. Bill Keck.
Yes, sir.
Welcome. You are also one of the nation's leading experts on public health policy, and you've been a public health official for 30-plus years. You've written textbooks, of course, and you are professor and chair emeritus at Northeastern Ohio University's Colleges of Medicine and Pharmacy, and my own personal mentor, if I may add, on issues relating to public health. Welcome to the show.
Thank you.
I know the two of you have just completed a new book, Principles of Public Health Practice, from Cengage Delmar, and we'll be talking more about that later in the show, but let's dig right in. What's the problem with medicine in America today?
I would back away from that, and I would not say medicine, what is the problem with health and health care in the nation? Yes. And I think those are, in some measures, two separate issues, because there are problems both with health and with health care. And the problems stem from several things. One is the socioecological environment that prompts bad health behaviors, smoking, obesity, lack of exercise, and whatnot, which in turn contributes to disease, which in turn must be treated. And there are disconnects all along that chain, if you will, in terms of our policy or lack thereof, running all the way from the socio-ecological determinants to the issues of actual provision of medical care services to a patient. Fair, Bill?
I think that's fair. I think we could summarize it and say we have a series of problems, beginning with the fact that somewhere around 50 million Americans don't have direct access to medical care. We have a system that costs too much and is not very efficient, and is oriented more towards the diagnosis and treatment of illness and injury than it is at preserving and maintaining health. And we pay a price for all of those.
What are the ramifications of 50 million Americans not receiving primary care?
Well,
not just primary care, medical care.
Yeah, but especially primary care, I guess. There are lots of ways you can look at that. There certainly is a moral issue here. I mean, one of the questions we ask ourselves is, are we our brother's keeper? Should we accept responsibility for trying to make sure that everyone is as healthy as they could be? Everyone has access to the services that most of us take for granted. That's one issue. Of course, not having access to care also means that our total health status isn't as high as it could be. We have very good information to show that if you don't have insurance or access to health care, you are less healthy than those who do. So we pay both a moral and we pay a monetary price for that.
Are you saying that it's more expensive to provide care for people in latter stages of illness than it is to provide them primary care in the first place?
Yes, I think we also have very good evidence to show that, and some wonderful examples in the United States where communities, one community, for example, determined that it cost them $600 a month for each person that wasn't insured. It cost the community that much to take care of the issues associated with that lack of insurance. And once people got coverage, that cost to the community dropped about in half. So it's really quite a dramatic difference.
But I think it's important to recognize two or three other points. If you look at the contributions to preventable mortality, that the medical care system is only responsible for about 10% of that total premature mortality. 50% is related to lifestyle, 20% is related to the environment, and 20% to genetic factors. So even if we were to provide access to medical care, health insurance for everybody, it still wouldn't have the impact that you might think it would have on the nation's health status. That's one comment I'd make. The second
Absolutely true.
And the second comment, I think, Bill, is that if you, in fact, enfranchised 47 million people, what you're doing is giving them a ticket to a broken system.
That's right.
That the system has been put together in bits and pieces and responding to particular problems or issues or what's politically expedient. So we've developed this kind of conglomerate that has no sense, reason, rhyme, interrelationships that occur. I think the other thing, Bill, that people have a tendency to neglect is there are a variety of different problems with access. There's financial access, but there's also the issue, for example, of geographic access. I mean, if you go back to where I come from in the mountains of Appalachia, there ain't doctors and there ain't hospitals, and those that are there are small and poorly staffed. And if you happen to get cancer in Hazard, Kentucky, the closest cancer center is 2 miles, on a portion of which is on a 2-lane highway in order to get any kind of treatment. So there's geographic access issues. And we're a nation increasingly diverse. And if you're Spanish speaking primarily, even legal, it's difficult to find some place where you can get culturally relevant care in a situation where your language barriers don't preclude getting the kind of care that you would like to get. Right. So health insurance is a piece, but it's a smaller piece, I think, of a broader problem that has to be considered in context.
Hi, this is David Kettlewell, host of the Medical Matters TV show. I'm here with a close friend, John Wright of American Ramp Systems. John, tell us a little bit about wheelchair ramps.
David, American Ramp Systems manufactures a steel ramp. It's an open mesh metal. It allows snow and moisture to pass through in the winter times, making it the most non-skid ramp on the market. We sell these ramps and we rent the ramps. We offer free home evaluations, and they require no building permits.
Very good. So when you need a wheelchair ramp, American Ramp Systems, freedom for life.